person that owns the building is charging us for the drawing package. When they solicit for bids, I will just give you some round numbers for the case of argument. But let's say that all the work that we want done comes in at $200,000. All of that work, they're going to have to bid out by contractors. We hope that the landlord is going to do that work. That will reveal itself in a higher rate that we're going to pay for that building. If we do the work, this $6,000 gets rolled into that cost. If we decide not to do that work, we're on the hook for the drawings.
Okay. Yeah, that's
Makes sense?
a little complicated to understand
is.
from the backup material.
It is, but
Okay, I appreciate that. Thank you.
you're welcome.
May I just add, sorry, I apologize. That these are drawings to get additional options and then get additional bids. We would then be coming back because depending on how much it costs, depending on what's reasonable, depending on where our organization is at that point. But that is part of these drawings, is to explore the full options and then of those options decide what make the most sense, just to be clear.
Thanks, Tracy. Any other questions for TJ? Nick?
That's all right. Yeah, as I read it though, it sounds as though there are some of this is to do the drawings, to do the plans.
This is
not
to do
the
the
work.
drawings to submit for bid.
Yeah.
That's correct.
And the question, in going to Donna's question, it looked to me like there were certain areas that were the responsibility of the landlord, and a lot of it is the responsibility of us that we would pay for. Is that not?
It is going to be all of our responsibility.
This is all ours?
That's correct. We're making we would like to make changes to the west location
Sure.
to facilitate a higher degree of safety, upgrades at the same time to the lobby, and in doing so, it's going to cost X amount of dollars. That has to be bid out by the landlord to have that work done. They cannot do that without a set of working architectural drawings. That's what these
Yeah,
are. Once we receive that bid back, we have the option to scale that project.
So this doesn't include like the plumbing that they're responsible for, the roof that
This is a triple net lease, Nick, and we're responsible for everything for the west location.
Okay.
If it's helpful,
Right.
this is step one. So step one is to get some architectural drawings of our ask. Then the landlord is going to bid it out. We then are going to look at it and say, here's, instead of doing A, maybe we want to do B, or maybe we want to do C. And then we'll come back to you, and that would be when you would know the actual full cost of what that is based on what we're getting. And yes, we're ultimately responsible for all the
But
improvements.
I thought the landlord agreed that they were responsible for the roof and certain
Those are done.
issues. Pardon me?
Those are done, and that was negotiated in the renewal of the lease that I brought before you
I remember.
back in October or November. Those are done.
Those
Those
are
were
done.
completed,
That's
yes.
why I said that doesn't.
Those are separate line items from what we're asking for.
Okay, now that makes sense. Thank you.
How long are we staying at the west location? I thought we weren't happy with that location, so why are we gonna dump a bunch of money into a location we're not staying at?
That's a great question, Wayne.
We agree. That's why we're doing step one, which is to find out what it will cost, and we will make a decision as an organization, what's the direction we want to go. We do still have concerns about, even with these potential enhancements, the west location not being as conducive as we would like it. But at the same token, we also don't have yet a location that would meet all of the requirements that we would like to. So we're pursuing two routes, making the location be the best it can be, but also still being open-minded of where do we want to be in about 2 years, to answer your question.
Okay, that's what I was looking for. I wanted to know where we really,
Megan, you have something? I do. Go ahead. Like, although the cost of things like that is unfortunate, it's just part of it. The real estate folks, understand that. And honestly, I think that given the extreme limitations of the building and having talked about safety and really working towards that and all of the issues there, I think it's something that we can't, although it is a cost and we have forthcoming costs, I think it's something that we can't do without. So it kind of is what it is, but I appreciate
I
it.
I would add that I'm consistently looking for property that would meet the demands of the west location for all those programs. It's roughly a 50,000 square foot building. There is not a 50,000 square foot building in Macomb County on a bus line that would serve us.
Well, I thought we were talking about using the second floor at the location on Hall.
Well,
Oh, okay.
Yeah, that's no longer an option due to the fact that we weren't able to get both those other two locations. It was
Right.
kind of a, if you had to do A and B for it to work.
Okay. Okay.
Any other questions for TJ? Okay, thanks, TJ. Do I
Thank
have a
you.
Motion and support, all in favor? Aye. Any opposed? Okay, item 5F, request to approve MCG Health Amendment 3, extending our contract for 3 years. This has been, I think this has been approved by legal, is that right? Okay, this has been approved by legal. I'll take a motion.
Support.
Motion by Donna, support by Antoinette. Christine?
Hi, yes, my name's Christine Brothers. For those of you that don't know me, I'm the director of our Managed Care Operations Department. And so MCG Health, it provides us the evidence-based care guidelines that we utilize when we're applying criteria to the utilization management decisions. We utilize their behavioral health care guidelines in conjunction with the clinician's own judgment to provide those decision support tools, and it helps determine level of care, length of stay for inpatient, psychiatric hospitalizations, partial hospitalizations, and crisis residential. It provides a standardization to the process to ensure inter-rater reliability in those authorization decisions. And then we also utilize their platform to perform inter-rater reliability testing for all of the licensed clinicians in the department. So that's what we're looking to extend that for 3 years.
Okay, thank you, Christine. Any questions? All in favor? Any opposed? Okay, thank you.
Thank you.
Item 5G, request to approve the purchase of printed community educational materials in the amount of $5,807.48. I'll take a motion.
So moved.
Motion by Antoinette, support by Selena. Tracy?
I'm excited to announce that part of this ask is related to our newest version of the Pocket Guide. It will debut at the Mental Health Matters Awards in May, and it's just got a few enhancements in it. So that's what you're approving. You're also approving or seeking approval for some RAC cards. Remember, RAC cards are those long, thin documents that we put throughout the community at tables when we go to events or we share them with our providers. So all of those over time, you'll show that those have also been revamped. But there's asking to print a few of those. There is more coming, just to let you know, this is kind of an initial order to get us ready for the May event and some current upcoming events in the next 60 days.
Okay, thanks, Tracy. Any questions? All in favor? Any opposed? Okay. Item 5H, request to approve CMH board bylaws, MCCMH 5-004. I'll take. Ooh. Motion by Megan, support by Lori. Tracy?
All of you received a copy of this in the board report last month, and then you're receiving it now. You should see that there are red line items in there. Those were recommendations by legal. Drew is available if you have specific questions related to those, but those are the only suggested changes. Just as a requirement, we are required to update the policies periodically. You will continue. You have 5. Every month, you will receive 1 or more in the same fashion you did with this one. The motive is for you to read it, think about it, ask questions. So we're just, unless you have any additional edits, if you approve it here, it will move to the full board. Then it will go through our signatory process, which is myself signing it. And then it also is signed by the county executive's office, and then it is published on our website. So if you do have any questions or concerns, you can ask this meeting, of course, also at the full board. But otherwise, we're assuming that you guys are in agreement with this update, or the updates.
Any questions for Tracy?
Wow, I thought for sure you guys would something.
I
right?
know.
Okay. I
Well
have
done,
motion and
Drew, then.
support. All in favor? Any opposed? Okay, it looks like the bylaws are updated.
Well, one of them.
One of them. Okay, item 5.6, receive, or item 6, receive and file, Airfoil Marketing and Communications Board update, for March 2025, and social report for March 2025.
So move.
Motion by Antoinette, support by Selena. Tracy, are you talking about this one?
I am. This was in your board package, but also it's also sitting in front of you. Again, like it's obviously from that, you have two different reports. One is on the, specifically on the social media. The other one is also including any type of other outreach. If I summarize, just want to draw your attention to the March has been the best month that we've had as in far as engagement and total engagement overall. I'm sure you guys know this, but we continue to grow on social media. Our reactions went up by 14% compared to February to March. And our total engagement rate went up by 26%, in case you don't know. Our followed members on LinkedIn is 3,824 as of March. In Facebook, it did grow, but not by much. It's 3,177. And our Instagram is growing, but it is nowhere near it needs to be. It only has a couple hundred people, but it is a new expansion that we've been doing. The other report also highlights some other interactions, not just social media. So I've mentioned this to you before, but there was an interview that I had the privilege of doing on CBS News talking about women's health last month. There's also a couple different items mentioned in there about the interactions that we've done in the community. So if you have not had a chance to look at it, I would encourage you to do so. It's a great way for you to know that how we are in our community and what that looks like. And I'm, of course, happy to answer any questions or talk about it in any other way besides I just stated.
I just wanted to say that Airfoil is doing a great job. Their social media posts for us are really, they're just really good, very engaging, catches attention, everything that, we're looking for. And it continues to grow as you see. And I think if you're on it, definitely share. I see a lot of us already doing that. So be sure to share with people that you follow so they will come and follow us. And then I was going to say something else nice, but I don't quite remember. I love it. Are we going to do TikTok?
Yes, here, I could explain why we haven't. So TikTok, in order for you to, and I'm too old to talk about this, but I'm going to tell you what I do know. You have to have video content, right? And you have to have this interactive video content. And just like any other social media, you have to continuously engage. We don't currently have the bandwidth to create the video content. You'll notice that we're starting to expand in videos. So if you notice on Facebook and LinkedIn, I think it was yesterday, we did Bruce and Matt, who are the previous winners of an award, did their video. And they're amazing, but that was like a whole task for us. We're not quite that advanced, but we worry that we wouldn't want to launch something like that until we had this continuous video content, right? We don't have that as of right now.
So I guess, I'm no TikTok whiz. I am on TikTok. I do have a decent following, but I also have a 23-year-old daughter who does all my TikTok stuff. But she has just kept me consistent to the point where I'm only doing 2 videos a week. So there's no more expectation, and TikTok has found the algorithm where it doesn't really expect me to do more. So it pushes my 2 videos, and I've actually gained like 100 followers just by being that little bit of consistency. And I guess because a 23-year-old is doing my videos, which one completely makes fun of me, I get a younger following, which I think is like for us would be really good to have that. But yeah, I think it'd be fun to say the least. But education on the videos only have to be 30 seconds. So if we did like one time doing a 2-minute video, edit that's our full month. If we're doing like a video and then a static picture with music behind it also counts as it. So
I do want to agree and validate that you're saying. I think we're trying to do Airfoil to come in and maybe do some little bit more media training with our folks. The reality is part of it is our staff are hesitant about being in videos, so we're just trying to empower them.
Yeah.
Right? Like you, I'm sure even for you, it's like a convincing that that's,
Well, one, like, if I don't have to talk, all for it. I'm like, so I'm in real estate. So she's like, just open the door, don't do anything. So I open the door, but I don't move. And she's like, well, you have to move out my way. So, and then I'm like, open the door, and then I move. And then she's like, that's it, you're done, move. Just, and then she does it. So that helps if I don't really have to do it. So, but yeah, I think they're doing great. So good job to them.
Okay, thank you, Antoinette. Any other questions or comments? Okay, I think I have a motion and support to receive and file. All in favor? Any opposed? Okay. Item 7 is resolutions. We have a resolution for Linda, our longtime board member, who I know we're all going to miss very much. Did we do anything with this? Or we read it full board?
that's my suggestion, read the full board. We, of course, are also going to do something for Linda when she's back in the geographic area. And I just want to take a minute to express, Linda has been with this organization in some capacity for almost 20 years. She has dedicated herself, as you know, in many roles, including our CIC board members. She's held officer positions for this for this particular board. So although she's not here, we just wanted to take a minute to say thank you. We'll, of course, at the full board meeting, express that also. And then again, we will share, once you guys approve it, the resolution and do some type of act in collaboration with you all to celebrate her many years of dedication. And of course, if anybody wants to say anything at all, we would welcome that.
Selena?
Yeah, for those that don't know Linda, Linda's been an advocate and a champion for anybody with mental health or any type of disabilities over the years. She is the most dedicated, organized, and tenacious person that we've ever had on this board. She has held almost every position. She has volunteered at the state level for many, many years. And for those, unfortunately, Sharita, for you, she was the one that was the welcoming committee and took every new member under her wing and helped them become acclimated to what their role was and what their responsibility is. Linda has big shoes to fill, and all of us are really going to struggle to fill the void that she is going to leave now that she's gone.
Well said.
I totally agree. Thank you, Selena.
And you'll have other opportunities to express your appreciation.
That sounds lovely. I can't wait to see her. I keep texting her and asking when she's coming to visit. Okay, so we will move that to full board. Item 8 is other possible agenda items. 8A is the CFO update. We don't have an update at this time, so I'm going to move on to item B, which is the CEO update. Tracy?
I will be brief. As you know, we traditionally do a longer explanation and board report at the full board meeting, but at a high level for some updates. I don't have any specific updates related to the possible procurement of the PHPs or the direct payments of the CCBHCs, but our additional efforts, I know many of you know the items I'm going to share, so please jump in if you know if you want to add additional information. But we had the privilege of meeting with 2 state senators, thanks to the efforts of board members, including Nick and Donna. And it was a great opportunity for them to learn about us and learn about our concerns about the possibility of privatizing the public behavioral health system. So I want to express my appreciation to Donna and Nick, but also I really think it allowed us to consolidate our message. So if you don't have that, we do through the partnership and also Phil, is a solid message that talks about why mental health matters, what's happening in Macomb specifically, and then it also talks about a generalized message about what our challenges are, and then more specifically how those individuals we're meeting with, what they can do and what we're asking them and how we're asking them to advocate. And then Nick, you're welcome to jump in, but we then also met with John James's office to try to share concerns about Macomb is in a good financial position today, but with the possibility of Medicaid cuts in the future, like what does that look like for Macomb? So we spent a decent, mostly Nick, spent some time explaining that, lo, this does matter and here's why it matters. And then the last item, and then Nick, if you could add, is the governors, if you didn't see, the state association does have the ability to very quickly email the governor the concerns directly about the possible procurement of the PHPs, or more specifically, the privatization of the public behavioral health system. So if you have not seen that, it'll be in my future updates, but please check it out. It's easy to do. A communication goes directly to the governor and also to the lieutenant governor. So Nick, I don't know, or Donna, if you want to add anything about the meetings, I welcome that.
I'd just like to add a couple of things. I think the meeting with Senator Kevin Ertel and Representative Denise Metker was very useful. Donna was real helpful in getting that set up. The conversation, Tracy did a good job of explaining what we're doing and why, but we also had a good conversation and brought to their attention the problems we've been having with the department and the inability to negotiate with the department, and also the privatization effort. I don't think they were aware of it as fully as we would have hoped. In fact, I think a lot of what the department is doing, they're deliberately not letting the legislature know, because the last 4 or 5 times they've tried to do the same thing, the legislature was instrumental in pushing back. But both of them understood what we had to say and agreed to go back and push for better meetings with more substance with the department to the extent they could. The meeting with Congressman James's staff included Tracy, Phil, and I. We had a little difficulty setting it up initially, but they did agree to have a staff meeting. We could meet with the congressman, but that's not a surprise to any of us who've been around a while. And we met at the district office for what I thought would be an hour meeting, and it actually went about 2.5 hours, I think. It was a very good meeting. They did not understand how managed care works, and we were able to explain that to them, and they got a clearer picture of a statement that says we're not going to cut benefits, but if you cut funding, then you cut rates, and then we end up cutting benefits, and they got a better idea of all of that, and I'm sure they'll carry that on to the congressman. But in addition to that, one of the really good things about that meeting was one of the staff members there is involved a great deal in their constituent relations work, and establishing the relationship between Tracy and our board and the constituent relation person, and her telling us the problems she's hearing about, I think it's going to be a very fruitful relationship for the balance of the year. Now they know how to reach us. All the good information that we've been developing, Tracy had with her a nice box of everything. They asked for more, and they assured us that they would continue to keep in contact, so the constituents that come to them with problems dealing with behavioral health and substance abuse, they'll know they can use us as a resource. And I don't think they were clear on that before that, but I think this really helped them to know that. On the issue of the privatization piece, as the advocacy organizations have not been completely on our side, although they insist they're opposed to privatization, but they have been supportive of putting out an RFP, and what we're hearing in the RFP is that they exclude governmental entities and force privatization. I don't think they understand that. As members, as most of you know, I'm on the board of directors of the Mental Health Association of Michigan as well. We're having a board meeting tomorrow, and I'll be pushing them to back off on the procurement piece. I don't know if I'll be successful at that end. We have been trying to I've been trying to get a conversation with Megan Groen, who's the deputy director, who's the boss of the people we've been dealing with, because I don't think the people we've been dealing with have authority to negotiate, or at least that's the way the negotiations appear. They either don't want to or they can't. Megan would be the next step up before we get to Elizabeth Hertel, who's the director. And I've known Megan for a long time, and I was not getting through to her, so I finally did get through by email, and her admin person reached out to me with some dates in May that we'll have a phone conversation. And I don't know what'll come of that, but I'll let you all know after it's done. I've also solicited the assistance of the labor movement. As those of you who have been through this the last few times know, the labor movement was instrumental in helping our state association in stopping the privatization efforts of the department in the past. And I talked today with Steve Rizeppa, who is the political and legislative director for Michigan AFSCME, and he assured me that they've reached out to the governor's office with the same message that our state association has put out. They've reached out to the governor's office. He's talked with the AFL-CIO and the rest of the coalition of labor groups, and they're doing the same thing, and all of them have been pushing out to the membership, appropriate membership, to fill in the survey that the department has put out to make sure that the department just doesn't just hear from those people who are mad, but hears from everybody, or cross-section across the board. But they're also, throughout the labor movement, contacting the governor's office with the same message that the Community Health Association of Michigan has asked us to do, which we have done. So we'll keep you posted. We intend to set up meetings with the rest, individual meetings with the rest of the Macomb delegation to the state legislature. Phil is reaching out to Congressman Egan, who has the other part of Macomb County. He lives in her district. I live in James's district, so I reached out to James. He's reaching out to her. I've talked to a couple of other legislators, and they're more than willing to meet, and we're working on setting up times and places. Wherever possible, we want to have Tracy there, and Phil as chair, and myself as chair of the Policy and Legislative Committee. But if other people are interested in attending, if some of you have a good relationship with a particular representative or senator, let me know. We'll include you in that process. But we're moving ahead on all of that pretty well.
Great. And then just some other updates related to that is Crossroads Clubhouse, because you know the guys, they're amazing. They went to a like coffee hour with the governor's office. And due to that, that turned then to the governor's office reaching out and saying, hey, we'd love to hear more from you. So Bruce today had a preemptive call just with like their administrative entity to potentially set something up with the governors, and we shared our talking points. I shared our talking points that we had created for James and the other ones, so he had some reference information. But that call was just to have initial kind of conversations with hopes of potentially setting something up. So that's another good prospect. And I just want to acknowledge, you guys already know this, but Crossroads does an amazing job, and that's what they teach. And the people there, right, is to advocate for the services that they have access to. So congratulations to them, and Bruce is doing a great job. Other updates related to that is, the state association continues to make efforts. If you aren't reading those, you should be receiving that information. When there's very specific information I think you might miss, you'll see that I put it in the board report, including there's an educational material on Medicaid, how it's funded, why it matters. If Medicaid reduces, what does that mean for Michigan specifically? So again, I put that in your board report that you'll get at the end of the month. I will try to draw attention to things just to make sure that you don't miss those important pieces of information. The last one is I want to give an update, and Helen, you're welcome to jump in, either if I misspeak or if there's additional information. But I did send this to you, but as you know, the federal government on March the 24th said to the state of Michigan and all other 49 states that any COVID dollars and ARPA dollars that they hadn't spent had to immediately cease and desist, I can't say that. But either way, they called it a stop work order. That's why I've kept on calling it that, just to explain. Then the state of Michigan on March 31st called an impromptu meeting and say, hey, we're going to issue you all a stop work order for any COVID or ARPA funds. The next day on April 1st, they did that. I did share that with you all in an email. What that translates to is any funding that Macomb County Community Mental Health had for COVID or ARPA had to stop on April 1st. But there is this weird quandary of what happens between March 24th and April 1st, but the state of Michigan would still be responsible for that, and we will have to work with them. But what that means ultimately is, one, we had zero COVID dollars, so that meant nothing to this organization. We then have we're going to lose about 200 and
We got about $500,000 left in the budget, but due to how the caterings have already been spent, it'll be anywhere from 2 to, at the most, 4.
yeah, that we are losing because they were ARPA dollars. It was only SUD that was utilizing them. Then I'm sure you guys know this, but the state of Michigan, along with 23 other states, are suing the federal government. That does not affect us, though. When I say what I mean by that is we still have a stop work order. We still have to not use the money. That would be way down the line. I'm sure you guys know, and we wouldn't necessarily be able to financially benefit anytime soon or at all. So essentially, the good news is there's no impact to the people that we serve. We basically are working along with other resources, including using our PA2 dollars when needed. But we will be phasing out programs that were already scheduled to phase out, because we had programs that were scheduled to phase out on September 30th. So all that meant, the example that Helen has done a good job in the past giving is there's a school-based program. Well, we're going to keep it running until school's out. Well, that was kind of already the plan. Does that make sense? So it's not a dramatic impact. And then you will see at the Board of Commissioners in May, the opioid dollars, the jail is actually coming to the Board of Commissioners to also try to offset that loss to sustain 2 programs that we have. So they are coming to the Board of Commissioners to seek approval to use a small amount of the opioid dollars to supplant that particular loss, just to give you kind of a heads up. If for some reason that did not get approved, we still have other things that we can maneuver around, because ultimately we just want to make sure the services and no one notices any type of difference of any sort. But the county was offering it as a possibility, because it made, for the purpose of what the opioid dollars are supposed to be used for, it made aligned very much with what these particular programs were doing. So that is the last update I have. I'm, of course, happy to talk about anything else or ask any questions or answer any questions.
With the changes that potentially are going to come with the stop and decease in the money, for the organizations that have grants from the state, human trafficking, victims of crime and assault, school-based clinics, those dollars, which I'll just let you know, in my organization, I have about $12 million in grants. With those we're already told maybe at 50% reduction. Have we started looking into how the people that benefit from the programs that just my health system, not any other health system, that gap is going to need to be filled? These are still people that are going to require these services. School-based clinics provide mental health and medical health in the school and to the surrounding communities when they have an outside door. Those funds are going to dry up. Human trafficking is going to dry up. Have we started just jotting things down on what that impact could potentially be to us when our dollars may be decreased also?
We actually had a meeting earlier today. We're trying to have what I would describe to you as various plans. Because the problem is, it's hard to make a plan when there's so many variables that are unknown. But I just want to compliment the leadership team and Drew specifically also, because that's some of the conversations that we're having is, okay, what if, and then this, and this, because you have to make a choice. And then what if, and then we have to do this, and this. So know that I would not be able to articulate in great detail, but know that we're being very cognizant of a lot of what ifs, but we're also not trying to be too preemptive and go too much down any direction until we know more.
Which makes sense, because I'm doing the same thing. I can't predict what the future is going to be. I don't even know what's going to happen tomorrow. But we are starting to already put strategic plans on paper on what does it look like. Instead of getting $500,000 per school-based clinic, I have $200,000. How many FTEs am I going to lose? Am I going to eliminate mental health services, or am I going to eliminate medical health services? So, we're starting to do the same thing, but, we're all kind of sitting in a pattern, but we cannot be reactive on September the 30th.
I greatly agree. It is my general understanding that, for us at least, right? And because remember, we just had the impact of the stop order from the federal government. Most of ours is in a contract, and there is a little bit, and we have a good financial standing this year through September. Our biggest worry is the CCBHCs and how that impacts. How much does that sway the money, and where does it go? But we don't have as much concerns unless the state of Michigan gets dramatically cut in Medicaid, right? So that's why we're having these conversations. Outside of that, those two factors, we don't have major concerns of major grants, because the majority of our funding is the traditional base. There's a few off ones, but it's nothing substantial in the big picture for us.
No, but you're just going to have to fill in the gaps where we can't.
Oh, no, great. You're absolutely correct. Agreed. And that's ironic. That's one of our statements that we keep on telling the community is, if you cut Medicaid, or if you cut even us, or this one, right? That translates into the hospitals and the jails and all those other community programs. You can take it away from us, but it doesn't make the problem go away. It just moves the problem to somewhere else and often exasperates the problem.
Correct. Thank you.
Antoinette?
So going back to the meetings with the reps and everything, if we do have a contact, do you have talking points for us just to
Yes.
get them over to you? Like, I don't want to do too much. Give me a little bit, pass it on. So if you have that, can
I do. My suggestion, I can send it to you, but it
Okay.
almost depends on the angle. So for example, there's a 1.5-page document, and they're literally just bullet points.
Perfect.
But this is for loss of Medicaid. Then there's another one that's just like, hey, we matter, and here's why we matter, and we don't want you to privatize. Does that make sense?
Mm-hmm. Yeah.
You almost have to pick
Yeah.
your message. But either way, I promise, they're bullet points, and they're as simple as Donna's seen them, Nick's seen them. They're pretty straightforward. So I will send them to you, or anyone who's interested. But then you'd almost want to talk to me about, because I have tons of other stuff, right? Like, in other words, what's important to that person you're speaking with, and how can we make sure we're tailoring the message so they see the value add for them?
Right. Okay. So even if if I'm going to present for the Michigan Association of Counties, that's one thing, but then I plan on talking to Veronica Kleinfeld as an individual, so to pass her along to you.
Yep.
So I guess I don't know, whatever you have, and then before I talk to them, you
Yep,
talk
I
to
can
me.
send it to you, and then after you glance at it, if you want to reach out, we can talk. And the same would be true for anybody else. I think that's a good starting point.
Yeah.
Yeah, and then if it's, as Nick can attest, and we then show up with whatever is needed, including a whole box like Sharita has in front of her, right, of all the material. Depends on what it is. We just try to make sure we're hearing,
Okay.
explaining without inundating them, because
Yeah.
it can be a lot too.
Yeah. Okay.
And I appreciate the offer. It's amazing.
Nick?
If I could, I would encourage everybody to do that. And as I said, if we're going to set up meetings, I'm going to set up a meeting with Veronica as well. If you want to join us and can, depending on scheduling, I realize everybody's schedules are difficult, that would be good. But I think the thing to keep in mind is that the legislature really doesn't have they can advocate, but they don't have a lot of control over the Medicaid, the federal reimbursement of Medicaid. That's going to be decided at the congressional level. But they do have a lot, or can have a lot to say about privatization and about the department's unwillingness to negotiate the terms of the PIHP contract. And so that's just kind of the way you want to make the divergence. But in the course of the travels, I would encourage everybody, if you haven't already, to send the communication that CMH of Michigan sent out, and Tracy sent out as well, to the governor's office and the lieutenant governor's office. They had a couple of folks to include in that. So that we reinforce that. If you haven't already, please do so. And in your travels, yeah, it's great if you're talking about something else because you have a need to meet with the legislator over something else. Add this in, that's great, but we're going to try to have those formal meetings as well, and invite people who have a relationship with any given legislator to them where possible.
So I feel like if I can get it in front of our MAC board, then they can reach out to more and kind of bring people.
That's right. And other groups like Michigan Association of Counties is an important player in all of this, and we want to recruit their support.
Woohoo.
Hey,
Whatever you need, I'm pushing.
There
So,
you go.
Antoinette, may I suggest we connect about that and get some materials, because I think that group, I think there's a loss of understanding at the county level. Macomb is very fortunate in the way that we're a department of Macomb County, we're a charter county, we have a strong kind of community-based. There is a lot of, in a lot of the counties, that a separation, and they don't understand, so I think it has huge potential to help them understand why it matters to them, and ultimately, I think there's also a lack of understanding of, like, the county ultimately, similar to what Selena was saying, is ultimately the one who's gonna brunt. Does that make sense? They're gonna be in the county jails, they're gonna be in the county hospitals, they're gonna, right? And they do have a financial liability associated with it, and I think there's a lack of that foresight. Yes. So excellent point, thank you. And I don't have anything else again to add unless there's other thing from,
okay, thanks, Tracy. Anybody else have anything they'd like to add? All right. Item C, reminder, we have a CMH Board Recipient Rights Advisory Committee meeting Thursday, April 17th, 2025 at 8 a.m. at the CMH Administration Building. And then D, reminder, we have our full board meeting Wednesday, April 23rd, 2025 at 6 p.m. here. Item number 9, provider comments. Are there any providers wishing to comment? Okay, item number 10, hearing of the public. Anyone from the public wishing to address this board? Going once, going twice. Okay. Does anybody have anything else they'd like to add? All right, then I'll take a motion to adjourn.
So move.
Motion by Megan, support by Nick. All in favor? Aye. All right, thanks, everybody. We're adjourned.